Hi, my name is Yvonne Bell. This is the video blog. And we were to basically look at the 3 different videos and answer the 4 questions. The first question was, are the sessions you watch similar to what you imagined a counseling session to be? Yes, it was. Except for, I guess I would say, the dancing and helping. It was a little different than what I was used to. I typically work as a pastor. So for some reason, the dancing or helping was a little different for me. I can't put my finger on it, but I kind of felt like it was a little weird. I've also watched mental health professionals do assessments and evaluate clients and things of that nature. Just the number 2, the second video. The second question was, from your readings in chapter 8, what skills and counselor characteristics did you notice? I did notice the counselors were the first counselor and the third counselor. They seemed to be attentive and empathetic and understanding. And the clients seemed very comfortable talking to the counselors as well. The second counselor did not seem very attentive to me. His body language was off. He started off as if he was paying attention, but somewhere towards the end, it did not seem like he was paying attention. But all 3 counselors did reflect very well. They did make suggestions, and they did have, I guess you would say, feedback. And the clients, I did see where one of them potentially maybe had some type of anxiety or fear. The first guy, I think he knew that there was some other problem, and it seemed like he was trying to pinpoint what he needed to do so that he could not keep giving the advice he had been given to everyone, and he was not able to follow through for himself. So I felt like he felt comfortable talking to the counselor. The next question was, what was the differences and similarities that I noted between the 3 counselors? Basically, the second counselor's, his body language was different. The first and the third counselor, they seemed very engaged while the client was talking, and they seemed to genuinely have empathy. And when you see that really makes people feel comfortable, or it gives the I guess the ideal that they genuinely care. The next question was, what questions do you have about the counseling session and how skills are used? Actually, I have 2 questions. The first question is there a wrong way to start a counseling session? When I had watched mental health workers start their sessions, I noticed that they do a small greet, ask how the client's day was, and then they just go in with the questions. So I wonder if that's okay, and should that be for every counseling session, or should it be that the counselor just opens up and allow the client to just conversate? All right, thank you. Bye-bye. Oh, and this was my initial post.